Hi, I'm Pete. I've had good health all my life. I've been fit and active, hill walking and such. I just like being outdoors generally. Well, I was well since my 20s. I've had a chance with my weight, but never really had a problem health wise. I retired from the steel industry and it's given me a chance to do more of what I enjoyed and do new things that time had prevented. One of the things I did was to join a charity fundraising and friendship group. It was indirectly through this group that my journey with prostate cancer began. Well, let's be clear, group's not responsible for my prostate cancer. In October 2017, that was the October following my 65th birthday, a couple of us from the group decided we'd both take part in Movember. It's when you grow a moustache to raise money for Prostate Cancer UK. Well, neither of us had much knowledge of prostate cancer, but we were aware that it affected many men of our age, and we did have some friends who'd been diagnosed. It was around the same time I was contacted by my doctor's surgery to have a flu jab. Well, I haven't had much contact with my doctors, and my first reaction was to stick to my belief that all drugs were bad. As I was speaking to the surgery, though, I asked if I could have a health check as I'd not had one for a few years. And the following week, I saw the practice nurse. I asked if I could have a PSA test, that test used to help diagnose prostate cancer. I was just asking for the test as I wanted to reassure myself that I was fit and well. Nurse asked a number of questions about my waterworks, obvious symptoms of prostate cancer is the need to have a pee regularly. Well, I didn't know to go regularly unless I had a few pints. Uh, well, we both agreed there was no symptoms of prostate cancer, but she would take a blood sample for the PSA to be sure. I think she might have seen perhaps there was something that was worrying me. Who knows? I'm glad she did though. 2 days later came the phone call. The doctor's surgery would like me to see a doctor and take a second test soon. The results of the second test was similar, and my GP arranged an appointment at Barnsley Hospital. Well, the appointment was within a couple of weeks, and it was not a happy wait, although it did give me a bit of time to read up on prostate cancer. I was reassured in my own mind that it was quite common and it could be treated and it'd only be a minor blip. When I went in for my appointment at Barnsley Hospital, there was a consultant, one of the specialists from urology, and a nurse. After the test, the consultant told me that he was quite sure that I had an enlarged prostate and that when the biopsies were tested, he'd be able to tell me how serious it was and discuss the treatment, but this would take a week or two. Well, and it can seem a long way for results after any test or examination, but trust me, the period after this test was really stressful and felt very long, and I didn't want to talk to anyone about it. I was back in the hospital early November. My wife and I sat in the office and listened to the preamble about the different levels of prostate cancer. And then came the bombshell. I had the worst at level 4. I know that the specialist nurse who gave me the news went on to sensitively explain a referral to Western Park, medication options and more, but my receiver was turned off. My mind was somewhere else. God, I was so glad my wife was there. I returned home feeling downbeat and miserable, and suddenly I felt very vulnerable and afraid. I just wanted everything to happen quickly. I'm not good at being ill. I've had little experience of it, and well, let's be honest, apart from worry and concern, I felt well. Yeah, and I still feel well. My head wasn't in the right place. I was on the phone begging early appointments, asking if I could be considered for cancellations. That was a bloody nuisance. Anyway, it turns out I needed further scans which detected small tumours in my spine, my hip, lymph node. Well, chemo affects people in different ways. I think I was lucky. Two things I did suffer were loss of taste, which developed into a bad taste, and at about 2 weeks into each cycle I felt unbelievably cold. Otherwise I was fairly active, although I did feel tired. The only other treatment I have now is to have a 3-monthly hormone injection. You may have a growing stomach. These hormone injections help suppress the growth and spread of cancer, but they do have side effects. So most notable in me is the increase in weight and reduced sex drive. Probably doesn't happen to everybody, but that's what I found. Yeah, men are very bad at discussing intimate details, and it was only recently, and after 4 years after I started with this, that the subject was covered in a new support group at the hospital. Yeah, we talk about all sorts. One of the group's chaps summed up the situation by saying living without intercourse would be devastating if it weren't for the fact that he didn't fancy it. It don't mean you can't have a loving relationship. No one ever talked to me about my sex life before this. After all my experience, I'd like to pass on this message to staff in the NHS who are having conversations with men. Please don't accept "I'm fine" too quickly. Just gently probe and involve partners or families where possible in order to tease out any concerns or wants and, for support. I felt like I was in a wilderness, and I found this new group to be a safe place both to tell my story and also to support others. Friendships have formed too. My wife said she'd noticed how much the groups helped me. She says she thinks that we men tend to keep our thoughts locked away, and talking's really helped to overcome a lot of worries. Info about healthy eating would have been good too. It's 4 years since I was diagnosed with prostate cancer, and I'm still active and involved. I've only experienced fantastic service from the NHS, and I recognise how professional and caring they are. Where I am now, that support group or something like that isn't as necessary, but it would have been a godsend in the early days to have someone to turn to for more than medication.